All right, welcome everyone again to our third session of cognitive fitness. My name is Katie Freeman, and I'm a staff member with the American Parkinson Disease Association. I'm so glad to be joined by Dr. Karen Torres, who is a neuropsychologist at the University of Washington. And today's session, we're going to be talking about memory and mood. Um, so I'm going to turn things over to Dr. Torres now. And thanks again for joining us.
Okay, welcome everyone. Thank you for those of you coming back for this next part of the series, which will be focusing on talking about our mood and how our mood can definitely.
Oops. Oh, sorry, Karen. Looks like you're muted.
Okay, was I muted the entire time? Sorry about that. Okay. So thank you everyone for joining us and coming back for the third lecture of part of this series, where we'll be talking about mood and brain function. Let's see. So just an overview of what we've done already. Week one, we covered lifestyle factors that impact brain function. Last week, we talked about executive function and how it's the most prevalent cognitive difficulty that people with Parkinson's disease may have. And we talked about strategies to improving aspects of executive function. Today, we'll be focusing on mood and symptoms of different mood difficulties that people with Parkinson's disease experience. And then the final week, next week, we'll be talking about cognitive training and specific hands-on approaches to exercising your cognitive abilities and training your brain to improve in all of these areas. So as far as the objectives for today's talk, first I want to discuss with anyone who's willing to share, the suggested assignment that was suggested last week. Then we'll move on to the topic for today, after which we'll have an open discussion. And Katie will be joining me in moderating any questions that you may have by raising your hand or in the chat. And then we'll discuss about the suggested assignment for this week. And so if anyone wants to share their experience with the assignment that was suggested for last week, and just to help us recall, I suggested that you think about a goal for that was coming in the coming weeks or months, and try to plan out how you would reach that goal by writing down the steps, coming up with any obstacles that may interfere with this goal, and just seeing how it felt to really, really tease out the different components of this goal, writing it down, setting a calendar. So I'm wondering if anyone was interested in sharing their experience with this assignment. Okay. Go ahead, Steve USA. You can unmute yourself now. Sorry, the name says Steve USA or Steve and Susan.
Looks like there's another hand up as well. Ours iPad,
Ours,
if you want to
ours
share
iPad.
too.
Ah,
Oh,
Did I,
Uh,
am
yeah,
I on mute?
go ahead.
Really, it was serendipitous because I just had a problem to solve of changing my email address.
Mhm.
The old email was, first it started by not letting me send anything. And it went on for days. And I looked online for people's suggestions, whatever, couldn't resolve it. So I knew I had to bite the bullet and get a new email address. It seemed overwhelming, that all the people and places that I had to change it with. So I said, okay, this is my project. And I did. I listed it in order what I thought would be the steps, and, you know, checking them off as I went. And I mean, it wasn't so bad as I expected, and I still have quite a bit to do. And I don't know how to actually end the other one officially, but the people, you know, just trying to figure out who's most important to know that I have a new email address. This was important because I knew that the link wouldn't come to my new email address unless I contacted you. So, I mean, I felt so good about actually finally doing something about this problem. And I hadn't had that class last week. I would have decided to do that.
I'm so glad to hear that you had a very tangible example of something that needed resolution, and that you thought about the different parts, you know, important things that would be needed to complete it. And it's wonderful. I think the point of planning things out is that it eliminates maybe the potential nervousness or the anxiety of not knowing what's coming, and preparing yourself for it. And that kind of alleviates some of that, you know, blocking that may occur in the moment that you're completing this task. So kudos to you for doing this. It's a wonderful example. All right. Ours iPad, you're next.
Okay, yeah. My name is Regine, and I have a trip that I'm taking with a friend at the end of September. Normally, the group that I go with, this is a Rhodes Scholar trip. Normally, they make the travel plans, but this time we had to make our own travel plans. And so I'm in the process of doing that, making the travel plans so they fit into the itinerary of the trip. And breaking it down into steps was really helpful. One thing I had overlooked was I didn't read the itinerary carefully, and so I needed to go back and make sure that I was flying in and out of the right airports.
Yeah.
And flying in and out on the right dates. So, and that was helpful. It was helpful to break it down first into steps and then go from there.
Absolutely. It makes it more manageable, right? It makes it seem, okay, these are things I can do step by step to get it done. So I'm glad to hear that it was helpful.
Yes, it was. Thank you.
Absolutely. All right. Anyone else wanting to share? Otherwise, we'll move on to this week's topic. All right. Okay. So, question for this week. What are common mood symptoms experienced by people with Parkinson's disease? Anyone want to say any ideas or anything that they're thinking about? There's a lot, so it is a big topic, but common mood symptoms for people with Parkinson's disease may include symptoms of depression, anxiety, apathy, which we talked about a bit last week, because apathy is closely tied to the function of your frontal lobes, and that's where executive function lives. Psychosis is another mood symptom that can be present in Parkinson's disease, but for the purposes of today's topic, we'll focus on depression, anxiety, and apathy, as those tend to be one of the most common symptoms. So we start off with depression. Some studies estimate that 35% of people with Parkinson's experience depression. Okay? For some people, depression symptoms may be present decades before the onset of motor symptoms. And of course, for other people, depression may set in after they're diagnosed with Parkinson's disease. So it goes with this notion that Parkinson's disease is not the same for any two people, right? They may experience symptoms, and especially mood symptoms, quite differently. Depressive symptoms, specific symptoms that are prevalent with Parkinson's can include, these deep feelings of sadness, difficulty enjoying things, feeling pessimistic about the future, especially with, with Parkinson's disease. You're told that it is a progressive disease, and so feeling optimistic can be very challenging, especially when motor symptoms and other symptoms are progressing. There may be feelings of guilt, guilt because, due to the difficulties with walking or tremor, you're relying more on caregivers, care partners, children to help out a little bit more. Some people with depression, if it gets severe enough, may start thinking about self-harm. So depression can be very wide-ranging, can be very different from one person to the next. Depression symptoms can limit, how people communicate with their loved ones, with friends, in social circles. There may be a reduction in the warmth that is felt when someone is being social, or definitely in relationships. Certainly, symptoms of depression can increase fatigue, especially if depression is impacting sleep. So it's all tied together. Symptoms of depression can lead to difficulty sleeping, which subsequently leads to increased fatigue, reduces motivation, and again, limits that social interaction with others. On the other hand, we have apathy, which we talked about last week. But just to, reiterate, apathy, some people would say that it's the most common mood symptom in Parkinson's disease. And sometimes people have difficulty differentiating between depression and apathy. So apathy is more focused on lacking motivation, lacking intention or initiation to do things, because there's a lack of interest. That interest that was in tasks that were previously rewarding and exciting is no longer there. And so there's a lack of desire to engage socially in meaningful social situations. There's a lack of interest in starting new projects. And if it's severe enough, this apathy can lead to having more of a sedentary lifestyle where, there's a lot more just staying at home, watching television, not really getting out, not talking to friends and family. And this will care partners are the ones who are helping with encouraging folks to do things, with setting up, a daily schedule, setting up a routine, because without that assistance, someone with significant apathy struggles to do it on their own. And again, the range of apathy can be quite different from one person to the next. On the other hand, anxiety, which some studies suggest is present in up to 31% of people with Parkinson's, and also can be present for years before the onset of motor symptoms, are those symptoms that increase your central nervous system. So kind of worry, your mind is, jumping from one worry to the next, or it ruminates in one specific worry about this trip is coming. What am I going to do? Where am I going to get this information? Am I going to be safe? What if this happens? So rumination can just spiral your thinking. And rumination tends to happen at night when you're trying to sleep, right? Or if you're woken in the middle of the night and then you start thinking about, what's worrying you. Anxiety is this idea that there's just a lot of nervousness and there's this inability to relax because your mind may be just going. But anxiety can also can manifest in physical symptoms like panic symptoms. So this feeling of your heart's racing, you're feeling, you have this sensation that the walls are closing in around you. You may get sweating in your palms. You may feel like you're maybe having a heart attack. That could be panic symptoms. And it's a different way that anxiety can manifest itself and present in an individual. So just because you may have excessive worry or excessive rumination, feeling nervous, that doesn't necessarily mean that you will also experience panic symptoms, which are the more physical symptoms. It's also possible that some people who just have panic symptoms don't have the rumination and the excessive worry. So it can present very, very, very differently. But with people with Parkinson's disease who have anxiety, they may start having a lot more challenges in day-to-day life with, feeling so worried about X that it's preventing them from doing other things like leaving the house. Or, they're worried that their medication's going to wear off and then they're going to get stuck. And if they're home alone, what are they going to do? Those are realistic worries to have, right? But they can become very excessive, especially as the disease starts progressing and the medications don't work as well as they once used to. So anxiety can be extremely pervasive in people with Parkinson's disease. So we know the mood symptoms that are common in Parkinson's disease. Do mood symptoms affect the brain, or does the brain affect mood? Any takers on this question? Okay. The current hypothesis is that both may be true. Okay, so mood symptoms can definitely lead to this idea of cognitive loading, meaning that, let's say your anxiety is just taking up too much room in your brain to let you focus and concentrate on other things that may be important. For example, you're having a conversation with someone, and so you're trying to listen, but then your brain starts thinking about what's making you feel worried, feeling nervous, and then your concentration attaches to that versus the conversation that you're having with this other person. So your brain is overloaded with the anxiety, and it prevents you from focusing on the task at hand. And so from my perspective as a neuropsychologist, I do a lot of cognitive assessments to see how the brain is functioning. But if someone comes into the assessment and they have a lot of anxiety, especially anxiety that is very noticeable, people are, just worried about their performance and they're engaging in negative self-talk, that anxiety can definitely impact their performance on our tests. If they're not concentrating on a list of words that we're reading to them to see if they can recall it at a later time, if they're not focusing on the list because their mind is elsewhere, they're not going to retain that list of words when we ask them at a later time. So what were those words on that list? And so memory becomes compromised. Okay, so that is one idea, that mood symptoms do perform this cognitive loading that impacts your abilities to learn new things, concentrate, etc. But there's also another hypothesis that mood symptoms and PD symptoms share the same biological underpinnings. For example, we talked about apathy last week and executive function. Both of those are affected because there's the dopamine that becomes depleted in the brain in this pathway from the basal ganglia where the Parkinson's begins, and there's a pathway that connects the basal ganglia to the frontal lobes. And so that is a reason why apathy and executive functioning may be both affected, because they live in the same part of the brain, the frontal lobes, that are disrupted by these changes in dopamine. When we think about depression and anxiety, for example, that may be affected because in people with Parkinson's disease, there's an overactivation of the hypothalamic pituitary adrenal axis. that means cortisol is being released into your brain a lot more than should be. And so when this chemical is being released excessively, it triggers inflammation. And inflammation is not a good thing for the brain or the body in general. Okay. So because of how this axis is responding to the disease of Parkinson's disease, it may be leading to symptoms of depression and anxiety. So I think just the take-home message is that mood symptoms can impact the brain, and then the brain can also impact mood symptoms. So it's a bi-directional relationship that exists. In Parkinson's disease, for example, so there was a study that came out looking to see, okay, do mood symptoms in isolation affect people with Parkinson's disease performance on a series of cognitive tests? And it did confirm that apathy, and only apathy, for example, had a negative relationship with aspects of executive function, okay, like problem solving, like cognitive flexibility, which we talked about last week. So apathy, as apathy increases, executive dysfunction increases. As apathy decreases, executive dysfunction decreases. So there is a relationship between this mood symptom and cognitive function. The same study found that anxiety had a negative relationship with attention and working memory. Working memory being, this ability to hold on to information in your brain briefly, manipulate it, and then, respond to the stimuli. So that they found again that anxiety specifically has a negative relationship with attention and working memory. So as anxiety increases, difficulties with attention and working memory increase. As anxiety decreases, attention and working memory difficulties also decrease. So there has been found a direct relationship between how these mood symptoms affect cognitive function in people with Parkinson's disease. But it has important implications for treatment. Can treating apathy, can treating anxiety help improve cognitive function? That is the big question that future studies should be looking into, because can some of the everyday cognitive difficulties that people with Parkinson's experience, can that improve if mood symptoms are reduced? And we need some more data to look into that. I think it's important to talk about how mood symptoms can lead directly to social isolation. Okay? And social isolation is incredibly important. So the definition for social isolation is a lack of meaningful social connections. Okay? Social isolation is actually having few social relationships, roles, group membership, interactions with family, friends, and others. Okay, so it's the objective measurement of your social circle. How many people do you interact with? How many groups do you belong with? Versus loneliness. Okay, the difference is that loneliness is the subjective experience of how little social interaction you have. So loneliness is feeling symptoms of depression or anxiety because you do not have those social roles or group memberships or interactions. Whereas social isolation is the specific number of social engagements that you have. Okay? So what can contribute to social isolation? Certainly having poor health, okay? Having cognitive difficulties, living alone, limited opportunities for socialization, pandemics, okay, and when this is a big one, because there's been a lot of investigation about how the COVID-19 pandemic substantially increased social isolation in elder communities, crime, definitely a social determinant of social isolation. Not feeling safe to leave the house can definitely contribute to isolation, and certainly depression and anxiety are big contributors to social isolation. So what does social isolation do to the brain? It impacts overall health in several ways. Mental health, it affects how people feel from day to day. It increases loneliness, of course, because that's the subjective experience of how little social interaction you're having, but also can lead to increases in depression, anxiety, sleep difficulties. If there's a lot of social isolation, that can lead to a decline in your physical health, okay? People who are isolated may engage in maybe less healthy habits, like drinking alcohol, smoking, sleeping too much or too little. Diet maybe not as great because you're not leaving the house. And certainly they tend to give little exercise. So if you're engaging in these behaviors that are not good for you, subsequently blood pressure may go up, your stress response and inflammation may go up, which can lead to an array of other cardiovascular diseases, blood pressure, cholesterol, diabetes, certainly. So it has been demonstrated to have a direct influence on your physical health, but also increases cognitive decline. Social isolation has been repeatedly shown that it is a contributor to people developing dementia, especially for people who experience chronic loneliness, okay? Because it's this subjective experience of feeling alone and having no course of improving social isolation, of feeling worthy of completing goals and interests. It's this chronic isolation that can definitely exacerbate the brain's stress response, which we talked about. So too much cortisol is being released into the brain, leading to inflammation, and inflammation is terrible for how the brain functions from a cognitive perspective, but also physical decline and mental health changes. So social isolation is a big part of not only, in the Parkinson's community, because people may feel more isolated because of their physical symptoms, because they can't move around as much. They're spending too much time. But if you add on top of that feelings of depression, feelings of anxiety, feelings of apathy, it's going to exacerbate that social isolation. And so with Parkinson's disease, you do your best to manage your motor symptoms through medication, through other treatment options, but the mood aspect, the emotional life of the individual is something that can be modified as well, that can be improved as well. And that's been the theme of our talk so far, right? So there's still plenty of things you can do that is in your power to try to improve your cognitive functioning, your brain health, and managing mood symptoms should also be at the top of the list. So we may all experience these symptoms of depression, anxiety, feeling disinterested sometimes. We can all experience that, okay? But there comes a point where maybe there should be more concern when these symptoms become much more prevalent, lasting for longer than a few days, experienced for most of the day than not. Some of us may wake up feeling down and blue, and the rest of our day can be a little somber, and that's fine. The next day will be a better day, and for some of us it does, right? Some of us it is a better day and we move on. But when it becomes persistent, these symptoms are present for more often than not, and lasting for a longer period of time within a day, that there should be some concern about the mood symptoms. When the mood symptoms start interfering with life, you know, there's so people may be so depressed that they have no interest in going to family gatherings, definitely no interest in trying new things, or, you know, relationships with significant others start being impactful, you know, because, for example, the anxiety may be so high that you don't want your care partner to leave the house, but they have to leave the house. And so there may be some tension there. You know, when mood symptoms, you know, people may feel so depressed that they're sleeping all day, or so anxious that they're not sleeping at all. You know, when physical exercise starts decreasing because there's just no motivation to get out of bed in the morning. And for those of you who work, you know, mood symptoms can in fact impact your work performance. You know, not getting out of the house is troublesome if you have to get to work, or if you're at work and you're having difficulty concentrating because all you can focus on is on your worries and your anticipation, that your work performance may begin to suffer. So it's when the combination of these mood symptoms lasting for longer than usual, being unable to shake them off, but also when it starts interfering with life, that, you know, mood symptoms should be further evaluated. So when it comes to what you can do, there's a lot of things people can do, okay? But if we're talking about things you can do actively and empowering you to hopefully, you know, get out of these mood symptoms, if possible, it's always important to lean towards others, okay? Increasing your social interactions on a daily basis can be helpful. And like we mentioned before, it's not about seeing someone in person or being out there, is reaching out to people via telephone or text messaging or letters. Social groups are important. So social support groups can be very helpful in allowing you to lean towards others who may be going through the same thing. And you can talk about strategies. You know, we've talked about how moving your body with exercise is important for your cognitive health, but it's also important for your mood. You know, you hear it more often than not. You know, people may dread exercising, but once they do it, they feel great afterwards, right? So moving your body can be helpful. Eating well can be very helpful, and sleeping well. You know, I was at another panel earlier this week, and they asked me to say the one tip for cognitive health, brain health. I'm like, that's hard. But if I had to pick one, sleep is incredibly important. We talked about this before. Sleep impairs your memory. It impairs your ability to process all of the memories you processed that day and to remember them the next day. So sleep is imperative and something you can work on in improving in your life. But there's also other treatment options too. If these mood symptoms appear to have come out of the blue, you know, all of a sudden you're feeling a lot of sluggishness, your mood is down, don't know why, you're sleeping more, I think it's important to consider ruling out reversible causes of mood changes. Things like medication. Talk to your doctor, and especially if something's been added recently, a question about could this medication be contributing to my mood is a good one. But certainly looking into your vitamin B12 levels, your thyroid functioning, you know, deficiencies in these areas can lead to mood symptoms, depression and anxiety. Having a sleep disorder, you know, like sleep apnea, can make people very grumpy the next day if they have sleep apnea that's not being treated, because again, sleep is important not only for how your brain is able to process cognitive abilities like memory, but also mood. Okay. So having a sleep disorder can definitely be a significant contributor to how you're feeling in everyday life. if your primary care has ruled out any potential reversible causes of mood symptoms, and it may be time to consult with a behavioral health provider, a psychiatrist, to see if adding medications can be helpful and alleviating the symptoms. But it's always important to consult with a specialist, right? Because you're taking medications for maybe Parkinson's disease or other conditions, and so it's always important to meet with a specialist who can tell you which medication would be the most appropriate in your case. And then there's psychotherapy. There's different types of psychotherapy. You can do it on the individual basis, meeting with a therapist one-on-one and talking about your symptoms and seeing how you can figure them out, see where they're coming from, and then working on them. There's group psychotherapy. Sometimes people are much more comfortable in working in a group environment versus one-on-one. And the group therapy it can be important because you're hearing and sharing, and you don't feel alone about the symptoms that you're experiencing, right? It's always helpful to hear, wow, she's also experiencing the same thing that I am. And it helps normalize the experience and not make it feel so alien. And specifically to the types of psychotherapy, cognitive behavioral therapy has been demonstrated to be extremely effective in decreasing mood symptoms for people with Parkinson's disease. It focuses on how your thoughts, let's see, I have a triangle here, how your thoughts impact behavior, which may impact feelings, or how your thoughts impact feelings and then impact your behavior. So this dynamic helps to really focus on the issue at hand. So for some people, for example, especially if they have anxiety, their first thought is the absolute worst outcome. This happens, and so this is definitely going to happen. So just thinking the worst. And when you think the worst, it makes you feel very, very anxious, like there's nothing you can do to change this. Okay, so that's the feeling. So subsequently, if you're feeling that there's nothing you can do, then you're not going to do anything. So that's how your thoughts of thinking the worst make your feelings of anxiety a lot worse. And this directly leads to how you deal with the situation. You're not as proactive, and you're not problem solving. So cognitive behavioral therapy can help you work on this triangle of how your thoughts connect with your feelings and subsequently connect with your behaviors. And this therapy tends to be time sensitive because it's very goal driven. There's homework assignments, so you will be given assignments to develop strategies for coping, for making change. And a lot of people have found this to be incredibly successful. Okay? And then the last thing I'll talk about is mindfulness meditation. So it's a specific type of meditation that focuses on attention and acceptance. So meditation in general deals with this concept of sometimes you're doing it in solitude, right? Relaxing your brain, relaxing your body, and really, really trying to be attuned to what's going on. Okay? You focus on your breathing. You focus on maybe other sensations that you may be experiencing. Mindfulness meditation is about focusing your attention on what your body is telling you or where your mind is taking you, okay? Focusing on what's distracting, not judging yourself for having these thoughts. So let's say you're trying to meditate. So you're isolated, you're sitting in a dark room, you're breathing in and out, and then your mind starts wandering into the worries that are coming later in the day. Oh, I have to do this, I have to do that. Meditation says, okay, let's focus back on your breathing, and you're breathing again. So you're not giving your anxious thoughts as much emphasis and attention because you're in a meditative state. And sometimes people can practice this mindfulness meditation throughout the day, when they're brushing their teeth, when they're having a walk, because it's about just being attentive to where you are in the moment and training your brain to be calm. And it takes, it takes a lot of it becoming a routine and a habit to be, successful. But people do it. People meditate for a minute, 2 minutes, and their entire day. And that can be enough, because there's been a lot of research to suggest that online and app-based meditation programs, there's a lot of them out there, are effective at decreasing how someone's mood, how they're struggling with mood, whether it's with depression or anxiety. So meditation can be a helpful response to mood symptoms. All right, okay, so that's all I have, and I'm open to any questions that people may have at this point in time, and then we'll return back to the assignment for this week. Hi, Jim.
Hey there, Dr. Torres. I don't remember if I learned this from you, maybe in one of these sessions, but you specifically mentioned the CBTI protocol for insomnia, and we were talking about sleep and the importance of that. Would you be able to say a little bit more about that specific modality, if you don't mind?
Yeah, absolutely. So for the cognitive behavioral therapy insomnia, so it's really, really focused on, okay, why aren't you sleeping? And for most people, if it's not related to a disorder like sleep apnea, it can be due to anxiety. Okay, that rumination that kicks in when you're trying to fall asleep. I can't fall asleep because in my mind, I'm just going through everything that I need to do the next day, and it's jumping from one thing to the next to the next. So CBTI specifically may focus, if that's the case, if that's the presenting problem, may focus on developing relaxation techniques and coping mechanisms to stop those thoughts at night, reorient them towards feeling calm or finding solutions quickly. So it's a very hands-on approach to what is affecting sleep. So the first task is to identify what is contributing to insomnia. And then that becomes the topic and the goal for the sessions.
That's helpful. By any chance, do you have a recommendation on resources? I was just looking on Amazon, and there's a few books and workbooks. Maybe you have an idea of anything?
I will definitely add them to these slides that will get sent out. So I do
Oh,
have
nice.
some resources at the end, but I will add more specifically. Are you looking for CBTI or just cognitive behavioral therapy in general?
Not CBT, CBTI in specific.
Okay. All right. I'll definitely add some there. Thank you, Jim.
Thank you very much.
Okay. So next one, Linda.
Hi, thank you very much. I do dip into anxiety and apathy. It's just kind of they cycle through here and there. But there's one thing that I'm curious about, and I don't know if it's myself masking it, but I can go through the day just going from one project to the next, totally happy being in my little nest and not even thinking about going out and being about, it's more just kind of like I'm in a place of maybe it's safety, tending to myself, but I have to really push myself to get out the door. And then once I get out the door and I go for a walk or I go to the store and engage with somebody, I feel fine. So it's not, doesn't feel like it's out of fear. It's more kind of like I'm just kind of happy just being where I'm at. I'm curious if you have any thoughts on that.
Yeah, and I think what you're describing, and I may be wrong, but it doesn't sound like complete apathy because you're engaging in things you want to do. You're working on tasks, you're moving from one thing to the next, but it's more of like the social piece and getting out of your home that is more of the challenge. But you're right. When you get out of there, you feel good. You could feel good
Yeah.
about these interactions. And so that may be more to do with, okay, initiation. Okay. What's preventing you from taking a break in the middle of the day from all of your tasks to get out there for a walk? Is it because your day is packed with things you have to do? This is why you're going from one task to the next, to the next. Is it because you're having more difficulties completing tasks? So things are kind of all over the place and there's just no room for a break. So I think maybe thinking or becoming more mindful of what exactly is preventing you from scheduling a walk at 11 a.m., putting it on your calendar, putting a reminder on your phone to get out there, and then coming back to completing the task. Because especially, with Parkinson's, and I've heard this a lot from patients, they have their on period, right? Where they're feeling that cognitively they're at their best and they need to get things done as much as they can during these periods. And so I always challenge and say, okay, rather than just doing things you have to do, why not also schedule things that you would think are enjoyable as well during this time, like a 10-minute walk outside, just to get out, get some fresh air, get some oxygen to the brain, which is incredibly helpful for cognitive abilities and mood functioning.
Right. Thank you.
Sure. Let's see, and are there any chats? Okay, so there's a question about supplements that combat inflammation. Someone mentioned vitamin C. Does anyone else have any recommendations? I don't have recommendations for supplements specifically. Katie, I don't know if you have any information on that.
I don't, unfortunately.
Yeah. All right. Anyone have any other questions or comments? Katie, anything you'd like to add in this conversation?
Um, I think just thank you for doing this presentation, Dr. Torres.
Sure.
This is great. Um, I will say that if anyone is, let me spotlight myself. If anyone is looking for resources in their local area, social connection, cognitive behavioral therapy, working with a neuropsychologist, you're welcome to reach out to APDA and we can help find those local resources and those providers for you and help you get connected with them. We're just a phone call or an email away.
I'll just throw this out for what it's worth. There is an app that I like. It's called
Mhm.
Calm, and it does
Mhm.
mindful. I see, that one. It does mindful meditation. It also does these things called sleep stories, which are
Mm.
kind of really nice little vignettes or little tales. They're very calm. Usually the narrator's voice is very mellifluous and calming and relaxing. So I quite like that as a tool. I don't know if it's free or not. I don't. They might have like a free plan and a paid
Mhm.
plan, whatever.
Thanks
Yeah.
for that, Jim. And another good app-based meditation service is called Insight Timer, which
Mm.
has hundreds of free meditations ranging in different lengths and some to address sleep as well. That's one that I use personally and really like.
Sweet.
And I will also include resources for meditation, which brings me to the assignment for next week. So let's see. Okay. Oh no, we stopped. Sorry. Okay. Okay. So I think it'd be great to pick one intentional action that you will work on to help you feel good. What makes you feel good? Do you know what makes you feel good? What could potentially make you feel good? Is it, I haven't talked to my sister in about a couple of months. Let's see what happens if I reach out to her and call her. Or I've been wanting to get out of the house and visit that park that I haven't walked to in a couple of years. Let's see how it looks now. So doing one thing, one intentional action that can help you feel good. Do you want to try mindfulness? And so these are 2 links that has information on mindfulness for beginners, essentially. What it entails, it can take just a minute of getting acquainted with what mindfulness and meditation can include. So I think this is a good start. And I'd be very interested to hear from you next week how this went. Okay, so just suggestions, not homework. Just if you have the time, choose one of these 2 options. And then next time in the final session, we're going to talk about cognitive training strategies. So we've talked about lifestyle factors to keep your brain healthy, nutrition, exercise, sleep. We've talked about how executive function is the more prevalent difficulty that people with Parkinson's disease may experience. And today we talked about mood and how mood impacts your brain. So I think to finish, we're going to focus on specific how to train your brain. What exercises, and not physical, cognitive exercise can you do in everyday life to keep your brain healthy? So we'll be talking about some app-based programs, online programs, but also old school, paper and pencil training that is available. And I think that will be a good way to finish up because, again, everything that we've talked about are things that you can take with you and practice on a daily basis. So that will be for next week. Okay. Let's see. All right. Anyone have any questions, comments? Otherwise, yeah.
I'll just
Go
throw
ahead.
out sort of an anecdote. I don't know if anybody else who's on the carbidopa levodopa experiences this, but since I've started taking that, it's been a year or so, I have the most vivid, intense dreams. They're in color, they're sight and sound, kinesthetic, feelings, motion. And I don't remember ever having that before. So I don't know if that's good or bad. I know you were talking about sleep being restorative and processing things, but I'm really busy in my dreams. So maybe that's tiring me out.
Well, it's just a matter of, is this affecting your overall sleep quality?
I don't think
Because
so. I don't think so.
if you're still
Just,
feeling refreshed when you wake up in the morning, that's a good clue. But if it goes from vivid dreaming to really acting out these dreams and hollering and kicking and screaming and rolling off the bed, then that's something that should be looked into. Yeah.
yeah.
Okay. All right, everyone. So I guess we'll end here. And like I mentioned, I'll include these slides. I think Jen sends them out on Mondays, but there'll be the resources there at the end. And Jim, I'll include CBTI resources in there. So I'll see everyone next week.
Thank you, Dr. Torres. Thank you,
All right.
Katie. Really
All right.
appreciate the wealth of
Thank you,
info.
everybody, for joining us.
Okay.
See you next time.
All right.
Have a great
Thank you,
weekend.
Katie. All
Cheers.
right. Bye-bye.